You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest has done over 1,000 dental implants, and we've invited him on the program. We've had him on the show before, but he said nobody should be wearing a loose-fitting denture that they're not happy with. With us, we have Dr. Gelfand. Dr. Gelfand, welcome to the program. Welcome back, I should say.
Thank you. Thank you, Randy. It's great to see you again.
Good.
I'm happy to be here.
I think it was about 5 years ago.
Yes.
Now, for people that don't know you, because we talked a lot about cosmetic dentistry, you have a lot of practices, Dawson Dental. Tell us a little bit about your practice. Who's the typical patient, and what are the different services you offer?
Right. Randy, we have 20 dental practices across Ontario.
Okay.
The typical patient, we see everyone. We're happy to see people for cleanings, for fillings, root canals, veneers, crowns, TMJ therapy, and of course implants. We see everyone. We have specialists in-house. We have amazing hygienists, and happy to see patients who love the dentist and those who hate the dentist. And we seem to attract a lot of patients who really hate the dentist, who haven't seen a dentist in years.
They're afraid of the dentist.
Yeah.
Because nobody likes a dentist, right? But you say they like going to you.
We give them sedation. We give them options. Those who don't like the dentist, we give them sedation options. Laughing gas, IV sedation, full general anesthesia, just like in a hospital. So they know when they come to us, we're going to make them feel comfortable.
Okay.
There will be options, no matter what.
We said at the top of the show that nobody should be wearing a denture they don't like. Is that the future of dentistry, that all dentures, probably, whether it's 20 years, 30 years, they'll all be attached to dental implants? Is that your thought?
It's definitely heading in that direction. The problem with dentures is that they're not attached to anything. And more people want to have something that's as close as possible to their natural teeth. They want to be able to function the way that they used to when they were younger. They want to be able to smile the same way they used to smile when they were younger. They want to be able to chew through food and taste it in exact same way without the plastic covering the roof of the mouth. And there's so many ways nowadays to give it to them.
Now, one of the things that you say, and we talked on the phone, is that in your practice, people could walk in on the day of the procedure, no teeth, and could walk out with teeth, a full arch of teeth that don't come in and out. Is that common?
Yes, Randy, all the time. People walk in without the teeth and walk out in one afternoon with fixed teeth that don't come out. It's incredible.
How old can you be to get your denture secured to dental implants?
Any age. The youngest person I've treated was in her late 20s, sadly. The oldest person I've treated was in her late 80s. I think she was 88, and she said that she wants to have fixed teeth. Her daughters were trying to convince her that it's really not necessary. She's lived with dentures for over 30 years. She insisted on having fixed teeth, and she got it. It was absolutely amazing. So we placed some implants on the top, implants on the bottom, and she has a full arch of teeth on the top, full arch of teeth on the bottom. She has a full set of teeth in her mouth, teeth that don't come out, and she's chewing like anybody else. She can chew through apples. She can chew through ribs.
With her front teeth, she can bite an apple?
Front teeth, yeah. With the back teeth, she can chew through steak. She says she can chew through, she can eat corn on the cob and even bite through nuts. It's absolutely amazing. She loves eating now. She gained a few pounds, which is okay, but she loves it. She really enjoys, and a lot of people comment. She tells me people comment on the type of foods she chooses to eat. The choices that she makes when she goes out are completely different than before. She used to be embarrassed by the foods that she couldn't eat, and some of the dentures would actually fall out. And other times she just would choose the food that she could rub with the dentures in order for the foods to be able to get absorbed.
When you're older, are they more likely to fall out? Are they more likely to have complications?
It's a great question, actually. As you get older, if you don't have teeth, what happens is your jawbone actually shrinks. With every year that you don't have teeth, your bone resorbs. Like anything else in our body, if it's not being used, if it's not being utilized, it just disappears with time. And this lady actually her bone has shrunk so much that some dentists told us she cannot have implants, which is incredible. I'm so happy that she found me, and we're able to use a different technique to be able to give her a full set of teeth that doesn't have to come out. And one of the things she told me, she wished she had it done many years ago. If she knew how easy it is, if she knew how life-changing this would be, she would have done it many years ago. Back to your original question. No, they're not more likely to come out, not likely to fall out. There's so many studies that are showing age just doesn't matter. Age has nothing to do with the ability of implants to stay in.
Okay, good. Now, are there even a lot of people with dentures? You're in Ontario. Are there a lot of people wearing dentures in Ontario?
Yes, funny you ask. In Ontario, we have over 1 million people with complete dentures. Over 1 million people without teeth that have full set of dentures. Last time I looked at the numbers, even I was shocked. And there are probably millions of people who are headed towards dentures.
So like their teeth are so bad, they're kind of coming out.
The teeth are either loose, or they're broken, or decaying, or all three. And they're heading towards dentures, unfortunately.
So if dental implants are so good, right, for these denture wearers, you call it all on four. 4 implants, a full arch of teeth that either snap in, snap out, or stay in there, right? If it's so good, why isn't everybody doing it? What's your take?
Number one, people don't know their options. If people knew their options, they would be exploring those options much more. So I find that the number one reason people don't get it done is because they just don't know what's out there.
Because they don't go to a dentist like you anymore.
Exactly.
Is that right? Okay.
Yeah. Or sometimes their dentist told them that they're not candidates, or they heard from a friend or from a family member that it takes so much more to get it done. Another reason many people don't do this, to answer a question, is because of all that they've been through before they had dentures. The life before dentures, let me tell you a little bit what's happening to people before they have dentures. They go through fillings, cleanings. People get traumatized as kids with the dentist, with bad memories. They have root canals, crowns, veneers, expenses after expenses, and pain after pain. And the only thing that's left in their minds is expenses and a lot of dentistry. And when they get to a point where they have dentures, even if they're not happy with the denture, they've accepted it.
Okay.
That's just the way it is. And people learn to adapt. Even if the denture is a little bit painful, even if it's loose fitting, they adapt because they remember everything that was associated with dentistry as a whole.
So they're afraid of the dentist.
They're afraid of the dentist.
I mean, nobody likes a dentist anyway, right? Nobody wants to go to the dentist.
So why would they go and get implants placed?
Okay.
Yeah, right.
Do you ever hear that? No offense, doctor, but I don't like the dentist.
At least 10 times a week.
Okay.
And I tell them it's not, no offense taken. Everybody hates the dentist. It's okay.
Because I know you're a funny guy, by the way. You're known for your sense of humor. Do you have a good comeback when they say that?
Yes, they laugh, and they feel better knowing that it's okay to hate me. I give them permission to hate me. It's okay, So we start a relationship of love and hate, and slowly there's much more love. Besides the fear of dentistry and fear of pain, there's also the expense part, right? They count the teeth, the number of teeth in their mouth, and they think that the number of implants that would require to have a full set of teeth in their mouth would be so expensive that they don't even bother asking what can be done at this day and age. And there's so many options. You mentioned one of them, and that's incredible. So much easier nowadays to gain a full set of teeth with less implants.
You say just 4 implants?
Just 4 implants.
And they get a full arch of teeth?
It's a special technique where we place the 4 implants not in the traditional sense, in a different way, and we're able to give them a full set of teeth. Not just that, but a full set of teeth the same day.
Interesting.
Many dentists will put the patients in a denture for 6 to 8 months while the implants are healing. But there is a way to actually put the full set of teeth on those implants that have been just placed, and they're going to walk out, go home.
The same day?
The same day.
So when I hear teeth in the same day, that's not just a slogan. You guys are doing it.
Yeah, we're doing this on a regular basis, and people are loving it. That's the new thing. It's absolutely great to see those smiles and the happy faces and the crying faces out of happiness, of course. Something else that people tell me is that that they have no time. You know, when people come for consultations, they ask me about what it's going to take. Very often they tell me, you know, I'm a busy person. You know, I've been thinking about doing this, but you know what? I don't have time for this. What else can I do? And when I tell them it can be done in just one day.
Like a few visits, right? Like you may have to go and get the imaging. They come back.
Right. One visit for the x-rays and for pictures and for some impressions. Second visit for the actual...
They get their teeth.
To get the teeth. The implants
Really?
and the teeth. Yep. 2 visits.
So they're surprised at that. And you say a lot of people are embarrassed.
Right.
To do this.
Right.
What do you mean by that?
A lot of people wait for years to come to the dental office because they're just embarrassed to open their mouth in front of a dentist. They are embarrassed to show how bad they think their teeth have gotten to. And that's a huge obstacle for them to overcome. They don't care, sometimes they don't even care about the dental pain or you know, the money, but they're just afraid to show somebody else what the teeth look like.
But you see this all the time. I mean, you see bad teeth.
Yes.
And you say that they say, this is the worst you've ever seen.
Every single person, you're right. Every person who comes in with teeth that they think are the worst, they're convinced that their teeth are the worst I have ever seen. And in the majority of cases, they're not. They're not that bad. You know, in many cases, some of them could even be fixed. And maybe another arch has to be replaced with fixed implanted teeth. This is a perfect example of somebody who is very embarrassed.
Oh my goodness.
This person speaks for a living. He's an announcer. He has his own radio show. He's a host.
That's got to be unusual, by the way.
It's not. He thinks it's unusual. But I see this all the time. The reason you don't see it too often is because they don't smile. They're embarrassed, so they cover their mouth, or they just learn how to smile with their mouth half open, and they think that this is the worst that anybody can possibly get to.
Okay, so when you see a guy like this, those teeth had to what? Come out? They had to go?
Yes, they had to go. Joe knew that they had to go, and he could not afford to walk around without teeth for even a day. He's the host of the show. He's speaking on the radio 3 to 4 hours a day, and he had to have teeth. So people like this, they can't eat very well. Some of the teeth were loose, some of the teeth were just broken down. He was in pain. I want to show you what it looks like after. Is that okay?
Okay, sure. Let's take a look.
Okay. That's him smiling. That's Joe really smiling. And he loves to smile now. He loves his life. He feels confident. He tells me that he feels 10 to 20 years younger. He feels better looking. I think he's better looking.
Yeah.
But he's proud. He's proud of his smile. He's proud of his new teeth, and he's so happy. It's absolutely amazing, and it shows even in his show. I have a lot of friends who are denturists, but he didn't want dentures. He wanted teeth that don't come out. He wanted his own teeth, permanent teeth, that he can chew with.
What could he eat? I mean, he could eat whatever he wants?
Whatever he wants. Corn on a cob, apples. He can bite through steak. He can bite through so much food he couldn't bite before with his natural teeth that will break him down. And he has his life back.
You brought a video. You brought a video of this guy.
I did.
Let's show a little bit of the clip, because it almost sounds like you're exaggerating, but when you see the clip, it's pretty dramatic. Let's take a look.
Man, they're solid. They're my teeth. They feel exactly like my teeth. It's like rewinding the clock 20 years and waking up and going, wow, look at what I can do. It's truly a life-changing experience to get it done. You won't believe the difference.
Very nice.
Yes, I love him. But Randy, that's what they all feel when they have their teeth again. When they have fixed teeth, permanent teeth, that's how happy they are. Let me show you a few more.
Okay.
Pictures. Now here's a lady who had loose teeth because of gum disease. Okay, they were loosening up, and she did not want to have dentures. Too young. She was in the late 40s, and she was embarrassed by what's happening. She had a dentist who told her that her best option is to have a denture, to have all the teeth out so the infection will be gone. But she did more research, and she found out that she can have a full set of teeth that are not coming out like dentures. And I'm so happy that she found me. We gave her a full set of teeth that replaced her natural teeth. And not only that, but her teeth, look at the gum line and look at the smile line. And you know, we talked before about cosmetic transformations. One of the things that are good, that are helpful with all my cosmetic background is that I'm able to not just help people with the surgical part, but design the final smile in a way that they'll be proud.
They look real.
They look real, they look natural.
I always feel like I could spot a denture, but no, these look good.
Yes. Look at her face before and how she looks after. She looks younger.
That's true.
She almost looks more educated, more fun to be around with. Actually, pay attention to how she smiles before and how she smiles after. Even her eyes. Before,
yes.
Right? Before she smiles because she had to smile, because we asked her to smile. After, she smiles with her eyes because she's happy to smile. She's happy about how she looks. It's not just a change in her smile, but it's a change in her overall appearance and attitude.
Like her self-esteem. Like her self-esteem.
Yes. Now, have a look at this gentleman over there. And same thing, look at his face before, look at his face after. Look at the teeth before and the teeth afterwards. Not just the teeth, but how happy he is. You know, he shaved, he knows that he looks younger, and he wants to look even younger. Look at the teeth, you know, he's got a full set of nice teeth. They look natural. Nobody can tell that they're implanted teeth, and he couldn't be any happier. When they call the office, people like him, and they tell us the stories about what they eat and how they eat and the new dates that they go on. It's absolutely unbelievable. We can be on the phone with them for hours, just listening to their stories. We get emails about how wonderful their life is, and not just with chewing, not just with smiling, not just with tasting food differently, but you know how it changes their dating life, how it changes their marriage. You know, they're not afraid to kiss their wives. You know, there's no more bad smell. Everything tastes good. Life just becomes more natural.
Now, you work together with some denturists where you are. Is that right?
Yes.
Because some people are now here. I mean, here in the States, you know, we're in San Diego, California here, airing in Canada, but it's become mainstream. I mean, literally, these denture wearers are getting rid of their dentures and coming in, and they're getting their teeth attached to dental implants. Is that slowly happening in Canada?
Yes, like many things that happen in the U.S., Canada also follows slowly, and I hope that we get to the same stage sooner than later, where there's less and less people who wear dentures that are loose and enjoy their life with fixed teeth.
Yeah, but isn't it true that if you have bad gums, right, bleeding gums, periodontal disease, you can't get dental implants?
No, it's not true. This is my perfect patient. We remove the teeth, and there's usually enough bone over there to be able to place the implants right away. Once the teeth are gone, the infection is gone. And we can place the implants, place the teeth right away. They're going to have healthy gums within a couple of weeks.
Yeah, but isn't it true that, what if you've been wearing dentures for like 30 years? You can still do this, or you don't have enough bone?
I'm happy you asked me about that question. You know, so far we've been talking about a lot of people that had bad teeth, breaking teeth, loose teeth, and they went from teeth to implanted teeth.
Okay. From
natural teeth to implants. Probably half of the people that come to see me had dentures. 10 years, 20 years, 30 years. One lady came to me about a year and a half ago. She had dentures for probably 40 years. Okay? And for the past 15 years, she had sores on her lower denture, on her gums from the lower denture. And she's been thinking about solutions. She's been eating soft foods, and almost anything she eats, she would end up with sores. She thought for sure she's not going to be a candidate. She visited 2 other dentists who told her that she's not a candidate for implants. So with her, on one afternoon, we placed 4 implants in that new technique, and we gave her a full set of teeth on that lower arch on those 4 implants. And she's been the happiest person ever. You know, she keeps telling me that, you know, if she knew how easy this would be, she would have done it 20 years ago. Of course, 20 years ago, that system wasn't available, but you know, 5-10 years it was. And she's one of my best patients. Do I have time to show a few more of those photos?
Sure, sure. We got about 3 minutes left.
Okay. Have a look at this guy. Look at the picture before and the picture after. The picture before, he looks so serious. Forget about the teeth for a second. He's trying to hide the teeth with a smile or lack of smile.
Yeah, he does look like he's tough.
He looks like a tough guy. It looks like an angry man, right? Look at him. And you know, he's not. He's the nicest, sweetest man with a wife and 3 kids that love him. And going through the transformation of having a full set of teeth that don't come out, and he's not embarrassed to smile.
Look at that. He looks great. And people need to know, look, I'm not siding with you. I'm just asking the questions. But these are dramatic photos. This is very nice. And they look real. And I'm not, again, I know you're the big cosmetic guy, but going into this, I feel like I could spot dentures walking down the street. So what, you have like your own lab? I mean, who makes the teeth? How do they come out looking this real?
We don't have our own lab, but we work with a lab that does a lot of those type of cases. And they know that we have high standards, and the teeth have to come out natural looking with natural smile design. And we give thought to every single thing that goes into those teeth. The smile design, the shapes of the teeth, the length of the teeth, the color.
You're involved in that?
Absolutely.
Okay.
It has to be not just good looking, it has to be natural. That's our biggest criteria.
So nobody will even know that these aren't the teeth they were born with, I guess.
Right. Nobody but me and the person that gets the teeth. Sometimes the wife or the husband, the spouse. Randy, have a look at this lady. She had gum disease, teeth that were loose. She hated the teeth. She wanted to have a whole new set of teeth, and she definitely didn't want dentures. She wanted teeth that would be as close as possible to natural looking. She didn't want to have fake teeth, and she wanted them to stay in the mouth, okay, permanently. Look at the after picture.
Very nice.
Look at the length of the 2 front teeth. See how they're a little bit longer?
Yes.
Very natural.
So that's by design?
That's by design. Supposed to follow the lip line. Okay, do you see that? Mm-hmm. You would never tell these are not the natural teeth, right? Yeah. And she loves it. Here's another patient. His teeth had to go. Now, I'm not saying dentures are bad, you know, not to offend denturists or anybody else that makes dentures. Dentures are a good solution. But if you don't want dentures, there's other alternatives. There's other solutions.
Okay.
You know, and one of the solutions that we came up with is a way to remove all the teeth, all the bad teeth, and place implants the same day and have a full set of teeth that are anchored to those implants. Now, on his, we use ceramic. That's the most beautiful. That's the Rolls Royce of all options.
Okay.
It gives you a very, very natural, aesthetic-looking result when you use ceramic over zirconia placed over those implants. Now, another option that one could choose is a denture, still a denture, that snaps to implants. Now, it's a denture, it comes out.
It's like a snap in, snap out.
Yep, it snaps in. Still significantly more stable than a regular denture. You actually have to use some force to remove it from the implants, but it stays in.
So it's a less expensive option than the fixed set of teeth.
Right.
They get a snap in, snap out denture.
Right.
Okay.
And it's a great option for those that can't afford the full set of teeth that actually are fixed and are not removable. I gotta tell you a story.
Okay.
There's a lady that came to me with an upper denture that she had for over 25 years. She forgot what food tastes like. Because you know we have taste buds in the roof of the mouth. and she asked me to give her a full set of teeth that are anchored to implants, and obviously the roof of the mouth will not be covered by plastic. She came a week later complaining that the food tastes different, and eggs, she used to love to eat eggs, and eggs don't taste the same anymore. She doesn't like eggs. She just realized she doesn't like them.
Because more flavor comes out?
Yes, and she just realized what eggs really taste like. On the other hand, she loves eating food. She loves everything else. She tells me she finally realizes how food really tastes like.
Could you eat like bacon, like chew on bacon with these teeth?
She chews on bacon, she chews on apples, corn on a cob.
Like raw broccoli? Could you eat broccoli?
Raw broccoli.
So it doesn't matter. I mean, they're like regular teeth.
Yes, anything you want.
We are out of time. Good stuff here. Final message to a patient that is either wearing dentures, right? And they hate their dentures. Like you said, it's not for everybody, but if you don't like your denture, do something about it. And then the person that's headed to dentures, they have bad teeth. But they may have heard you talk, but they're still skeptical or afraid of the dentist. What do you say to them?
We invite them in. There's no cost for the first meeting, for the initial consultation, and we spend as much time as possible with them to understand what they want, what their needs are, what their hopes are, and what their fears are, and work with them to find a way to make it as affordable as possible for them, work through the options of simple dentures as opposed to dentures that snap on a couple of implants, or a full set of teeth that are fixed to implants and don't come out ever. And we explain to them what sedation options they have, whether it's taking a pill to make them relax for the next few hours, partially sleeping, or IV sedation where they're in and out of sleep, or full general anesthesia where they're completely asleep through the whole procedure.
I want to thank you for coming on the show. Very nice. Very good.
And it's been a pleasure.
And it's a free consultation.
Yes.
Okay, good.
Happy to see everyone.
Great. Thanks again for coming on the show. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.